In the United States, pneumonia causes more deaths every year than all other acute infectious diseases combined. Although control measures have caused remarkable drops in typhoid fever, in diphtheria, and in smallpox, the downward trend in pneumonia has been very slight. Records show that of every 10 untreated pneumonia patients, 3 will die. When proper specific treatment is given, at least 2 of these 3 deaths can be avoided. But only when the public will recognize the seriousness of the disease and that early proper treatment is of vital importance. When the physician who is called in uses the most modern methods of treatment. When the necessary drug therapy, proper type serums when advisable, and adequate laboratory procedures are easily and readily available to everyone. And when, for those who cannot afford the expense of treatment, these facilities are provided by state and local health agencies. Pneumonia is caused by germs, the most common type here shown highly magnified within its protective capsule. These bacteria are carried by certain people and released into the air by coughs or sneezes, and thus transmitted to other people who breathe them in. Normally healthy people are able to overcome such germs because their body organisms are functioning properly. Their resistance is high. In others, such as this man with a cold, pneumonia germs are likely to spread and result in pneumonia. Pneumonia causes many deaths among babies of from 1 to 2 years. At the other extreme of life, people over 65 are likely to be victims of pneumonia. Alcoholics, too, have weakened their body resistance to a dangerous point. Pneumonia is largely a cold weather disease, and exposure is a predisposing cause. Exposure and fatigue. As a case in point, Ed McGrath here, troubleshooter for an electric company, has been working unusually hard in bad weather. This evening he arrives home with a sudden hard chill. Mrs. McGrath, suspicious of fever, quite properly leads him straight to bed. The thermometer proves that fever has accompanied the chill. These are common signs of the onset of lobar pneumonia. McGrath must rest quietly, for if it is pneumonia, he will need all his reserve strength. His wife, without delay, calls the family physician and tells him of the circumstances and of the symptoms. Because of McGrath's low resistance due to exposure and fatigue, the pneumococci, which he has picked up somewhere, have penetrated the lung tissue and have spread, causing most of a lobe of the left lung to become inflamed. This highly magnified view of an air sac within a lung shows how the inflammation causes a pouring out of fluid and of leukocytes and red blood cells. As more cells appear, some of the fluid is absorbed, and the mass of lung involved becomes more and more solidified. The physician, after a preliminary inspection of his patient, listens carefully with his stethoscope to the rapid, shallow breathing and notes the pain incident to it. The inflammation has spread to both linings of the pleural cavity, causing pleurisy. The rubbing friction in breathing and stretching of the inflamed tissues causes the pain. The doctor at once takes a sample of sputum from McGrath's lung. And next, a blood sample from a vein. A laboratory examination will disclose, from the pneumococci present in the sputum, what type of pneumonia McGrath has as an aid to specific treatment. Prompt action is highly important in treating a pneumonia case, and proper action must be based upon full and accurate information obtained partly from microscopic examination in the laboratory. Analysis of the sample of blood will help in determining the nature of the treatment necessary. And now, without waiting for the laboratory report, the physician begins the drug treatment, which has proved so effective in nearly all pneumonia cases of this kind. A prescription will permit Mrs. McGrath to obtain an ample supply of the drug from the nearest source. McGrath has begun his fight against pneumonia under good conditions. From the sputum test in the laboratory, the germs causing McGrath's illness are isolated and examined. Of the more than 30 types of pneumococci, it is determined that these are type 1. This information is conveyed at once by telephone to the physician.
Dr. Smith, Mr. McGrath has type 1 pneumonia.
Other items follow on form cards as soon as they are completed. These detailed reports will enable the doctor to begin specific treatment without further delay. The sputum analysis shows type 1 pneumonia. The blood analysis discloses that no bacteria were found in the bloodstream, and the high leukocyte count of 25,000 shows that the body's white cells will be of great help in fighting the disease. As is characteristic in pneumonia cases, McGrath's fever has weakened him. It has increased his irritability and difficulty in breathing. A nurse, temporarily called in to help, is making him more comfortable by cleaning his teeth and refreshing his gums and mouth. This treatment, given 2 or 3 times a day, removes the irritating discomfort of a fever-parched mouth and is conducive to the rest and conservation of strength which are essential to McGrath's recovery. Finally, a little mineral oil on the dry lips adds another soothing touch. Mrs. McGrath is rapidly learning her duties and now brings in a glass of the fruit juices which form an important part of the diet, together with foods of high caloric value. By using a bent glass tube and by supporting the patient's head, drinking is made easier. Regular administration of the drug treatment continues. The drug tends to stop the growth of the germs and consequently lessens their irritation, as evidenced by the sharp drop in McGrath's fever. Already, after only 1 day has passed, the doctor notes with satisfaction the prompt improvement in temperature, pulse, and breathing. A later analysis, however, has shown the presence of germs in the bloodstream, and it is found advisable to administer the type 1 serum. The serum causes the pneumococci to lose their virulence. The protecting capsules become soft and swollen, and the germs can be more readily destroyed by body defense cells. And now, only another day later, in McGrath's case as in many others, the treatment has resulted in an almost immediate improvement. This can be noted from the quiet sleeping, the greater ease and depth of breathing, and the decided drop in temperature. Mrs. McGrath, having learned her duties, has been able to replace the nurse and is here administering the drug treatment, which usually continues in smaller doses for several days. Each 24 hours tells a story of continued improvement. But now, proper diet, treatment, and general care are of as vital importance as ever. A tepid sponge bath daily, followed by an alcohol rub, contributes to the patient's comfort, particularly if he is not allowed to move himself, but is moved when necessary by another. In this way, his energy is conserved, for he has gone through an extremely weakening ordeal. Mrs. McGrath has been careful to conserve her strength also. Her high resistance has overcome germs with which she has come in contact. Now that all signs point to checking the infection, the doctor gives his final instructions.
Mrs. McGrath, your husband is now past the most dangerous part of his illness. But his future care is equally important. He must receive plenty of rest, fresh air, and an abundance of nourishing food.
McGrath has passed his crisis. The portion of his lung that was inflamed and later almost solidified has now begun to clear up, the detritus first becoming soft and then being absorbed. Although during convalescence, the utmost precautions must be taken against relapse, McGrath is fortunate. He is fortunate because his wife quickly put him under expert care. because he secured early diagnosis and typing. He received proper drugs and serum, ample liquids and high-calorie content foods, and because energy-saving devices helped conserve his strength. In pneumonia cases such as McGrath's, records compiled from reports of thousands of physicians show that the chance for complete recovery is exceptionally good.